This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. Do you remember what you were looking to leave behind when you left inpatient to go to endoscopy?
Simple things like just alarm fatigue. I just remember like coming home after shift and I would shower and I'd still hear noises beeping. Yeah. And, it's like so simple, but that, another thing was, living with, he was my boyfriend at the time, but we would go like sometimes 2 to 3 days without seeing each other. And I was like, I just want to be able to come home and like have dinner together, like simple as that. But I was just like, he would work longer days and then I would go in for my night shift. And then by the time I came home in the morning, he was already gone, which was fine for like short periods of time. But it felt like we were going lots of periods of time where I was either working a whole weekend or during the week, we just wouldn't see each other much. And I just wanted a little bit more like routine life. Yeah. I don't miss the feeling after a night shift either. You're just that lag. Yeah. So before I did go to endoscopy, I switched back to days for a short period of time, just to try to, rejuvenate and get back out there. But bone marrow transplant patients too are quite difficult in the sense of their whole world is flipped upside down. They're there for months on end. And as the inpatient nurse, you're only seeing when they're not doing well. So I was creating a lot of really good relationships with my patients, but then they would pass away. And I had a couple towards the end that like hit me really hard. And then the ultimate, like I pulled the cord of doing it was my grandmother was diagnosed with leukemia. And then everything was way too close to my outside life, my work life. I remember like going into work crying before my shifts and like nothing had even happened yet. Like it was like anticipating.
All in your head.
Correct. So I was like, I'm good at what I do. I like know what I'm doing, but I like clearly don't like my job if I'm crying before I even start it.
That's such an amazing, like, because you're exactly right in the sense that, like, you're good at what you do, you like your patients, but then, like, there's such a disconnect there because, like, it's really has such a heavy weight effect on you, but you can, like, deflect yourself from it to a degree, like, you just realizing, like, those two, something's got to give.